what breast cancer reconstruction means to me is, as a woman, you feel a little bit more complete when you wake up in the morning and when you see yourself in the mirror and you see yourself as, a woman with breasts and nipples and areola, and when that is all gone, you feel like a part of you is missing, and it shouldn't be that way. So I think breast reconstruction, I believe and I feel breast reconstruction is really important for all the breast cancer survivors out there, is because it makes them feel so much better about what they've gone through cosmetically. That small surgery can make someone feel so good about themselves, and why not? Because they've been through so much, it's the least that we can do for them.
I've been in private practice for 16 and a half years now, and I can't tell you the number of breast cancer patients that I've personally treated, but it's definitely in the thousands. I have performed breast reconstruction after mastectomies, after lumpectomies, breast revision procedures involving implants, fat grafting, free flaps from the tummy or the inner thighs for decades now. And I can tell you that participating in a woman's breast cancer journey, being her breast reconstruction surgeon, is so immensely rewarding. Breast reconstruction can help a woman to feel more whole again, to feel feminine again. It can help to restore her sense of self, body image, self-esteem. It can help a woman feel more comfortable in front of her romantic partner, getting changed after a fitness class in the change room. And every time she's in the shower or looks in the mirror, it can be one less reminder about her breast cancer experience. We can't completely restore the breast. It won't breastfeed, and it will never feel exactly the same way as it did before, but breast reconstruction is such an important component of the whole breast cancer journey, and it's really an honor and a privilege to have played a role in so many women's lives by helping with their breast reconstruction.
What does breast reconstruction mean to me? A new day. For all the women out there with breast cancer, the reconstruction gives them a new day, a new way to see themselves.
Breast reconstruction is allowing women to have choices when they are diagnosed with breast cancer. Not everybody has a choice, depending on the type of cancer that you have, depending on your anatomy, but also just what you're having to deal with. When you meet somebody that's very young, there's so many other choices that you have to make during this journey, whether you're going to save your eggs, whether you're going to get pregnant, whether you're going to get married, all of those things. When you're a little bit older, it's just a scary situation to be in, because you don't know what your choices or what you're going to be up against.
So breast reconstruction is an opportunity to allow women to exist in their bodies in the way that they've always intended to. It gives them a sense of femininity, a sense of themselves, maybe in a way that they've never really had to face before, but it gives them access to their body in a way that they have lost control because of things that they have been diagnosed with or had to deal with throughout their experience.
How has breast cancer touched me personally? Well, my sister was diagnosed at the age of 40 when she was ready for a mammogram, and it was very, very difficult. It was a difficult journey to go through it with her because she has 2 small children, and as an older sister, I'm very protective, and it really shook me, and it shook us, our family. What it also did is brought us closer because of the journey that she went through. She's lost 2 friends along the way, 2 really close friends, and we are just grateful for every day, for every moment, and I am so blessed to have been a part of her journey.
I haven't been touched by breast cancer personally, but it runs in my family to help breast cancer patients. My father was a mastectomy and lumpectomy breast oncologist at the University of Toronto for 30 years. My sister Ingrid is a genetic counselor, helping women facing breast cancer in Toronto as well. And I have been treating breast cancer patients for decades now.
I have personally been affected with breast cancer through my grandma. She was diagnosed in 2002 with DCIS, and I was really little at the time, but my understanding of it was really vague in terms of I didn't really know a lot what was going on, but the one thing that my grandma always reminded me of is that her heart and her soul and her spirit was always going to be the same. And that's going to be true for you too.
I have been touched by breast cancer personally. I have 3 aunties in my family, very close aunties, and they've had breast cancer, and 2 of them have had breast reconstruction, and they are struggling, but they are moving on. They are strong and very positive.
The very best compliment I've gotten from a breast reconstruction patient or their partner is that they don't feel that like they've had breast cancer anymore. They know it's part of their past, and even though the sensation is not exactly the same as it used to be, they feel like themselves. And I actually had one patient's husband tell me, Dr. Horton, after if I stand behind my wife and I'm touching her natural breast with one hand and the reconstructed breast with the other hand, they feel the same. I can't tell. And so I said, that is awesome. Thank you so much for sharing that.
I took this position in this office because I really wanted to make a difference for patients that were dealing with breast cancer. It was my first time in this industry, but I have a very special story with a patient that I really got to know during her recovery. She was very scared when she came in, and I was her support system throughout the whole thing. She asked me if I had a child, which I did at the time, and she gave me an opportunity to enroll my child in her daycare. It was the best experience for my child, but it also allowed me to get to know her on a very personal level. And for me, that is the reason why I've been here and I've stayed here.
You are never alone. As crazy of an experience as it may feel, there is so many people that want to help and want to support and want to cheer you on. So just let us.
We will make sure you get what you need, what you deserve, and we got your back and your front.
You're not alone. You're not alone, and you won't be alone because we're here to take care of you.
For women who have just been diagnosed with breast cancer, I have been doing this for 30 years. I am the patient coordinator. I just want to let you know that during this scary time and journey, we are going to be here through it all. Through the sad times, the happy times, and all the really good times as well. I will walk you through every step of the way. I'll make sure that all your questions are answered, and we're going to be part of your family during your breast reconstruction.
When I meet a patient in consultation for breast reconstruction, the first thing I say to them is, we're going to take really good care of you. My job is to help maintain your body image to the best of our ability, to make the breast look as natural as possible, as symmetric as possible, and we will get you through this. We work, of course, together with the breast cancer surgeon, the medical oncologist, the radiation oncologist if they need to be involved. And together as a team, we will work together to plan the very best procedures for our patients. We keep in really good touch with our patients. We get to know them personally, and we will see them through all their stages of recovery after surgery, and hopefully they can help us celebrate future breast reconstruction awareness days just like this one.